The government will launch its annual free flu vaccination program Monday. This year, 6 million doses of flu vaccines made by 3 different manufacturers have been made available. 9 different categories of people, such as the elderly and youths, qualify for the free jabs, while other members of the public are very enthusiastic about paying for their own flu shot. A pediatrician has suggested that people get their flu shots early, as this will help doctors distinguish between patients with flu symptoms and those with COVID symptoms.
A big stack of pre-booked appointments piled up at this clinic. They are advance orders for self-paid flu shots. This year, under the influence of the COVID-19 pandemic and ahead of the flu season, the public has been extremely enthusiastic about getting their recommended flu shot. This year, the numbers of inquiries and vaccinations are very high. The main reason for this is that the coronavirus and influenza are both prevalent at this time of the year. Advance appointments for self-paid flu shots at my clinic are almost booked out. Many clinics have advance bookings that are at 70 to 80% of their overall capacity. In addition to self-paid flu shots, the government will start giving free jabs on Monday as part of its annual free influenza vaccination program. And the Centres for Disease Control has prepared 6 million doses. Pediatricians are urging the public to get their shot as soon as possible, so that the doctors in future can determine whether patients have the flu or the dreaded COVID-19 virus. It's difficult to distinguish between the symptoms of the coronavirus and influenza. Even doctors can hardly tell them apart, so what can you do? In the end, there are only screening tests. If you're vaccinated against the flu, at least you can eliminate symptoms that are caused by the flu, and the chances of you getting mistaken for having the coronavirus will be greatly reduced. The government's vaccine this year is a quadrivalent vaccine made by 3 manufacturers. Sanofi, a French multinational pharmaceutical company, along with Taiwan's Adimune and TTY Biopharm. 2 kinds of the vaccines have been developed from chicken eggs and 1 from the cells of mammals. They offer roughly the same protection. Those eligible for the government's free influenza vaccination program include children aged from 6 months to preschool, primary, middle and high school students, vocational high school students and people over 50. In addition, nursery staff and medical staff are eligible. Altogether, 9 different categories of people qualify for the free shots. In addition, to cut down the time spent on waiting in line, the Centres for Disease Control has provided a map on its website, which allows members of the public to easily locate the clinics near their homes that have the free vaccines.